All our volunteers are wonderful people, all of them. The ones that I work with in particular are the pastoral care volunteers, and they visit patients and they just do a beautiful job. Very often when I go in to visit a patient, they'll tell me about a lovely visit they've just had from one of the volunteers. So they're very much valued by the patients and also by the staff, because members of staff sometimes will say that there's a particular person in such and such a room and maybe they could do with a listening ear, and just having the volunteers there to go in and spend time with them is just wonderful. But the volunteers will also sometimes come to us if they feel there's a patient who needs particular or extra support or spiritual care. And when they do, when the volunteers come and they maybe mention somebody that could use a wee bit of extra support, I'm always amazed at their sensitivity and their kindness, that they've noticed that that patient could do with some further support. So we are very privileged to have the volunteers, not just as patients and staff, but here in spiritual care. One of the big things for us, of course, is to look after our volunteers, and that's a conscious effort on our part. On the one hand, we're very grateful for what we do, but we never take them for granted, and we're always trying to make sure that they're cared for and looked after. And we have a policy that they should never leave the hospital with anything burdening them in relation to a visit, that they've made to a patient. So our doors are always open. In general, a good volunteer is a volunteer who really cares about people and who knows how to listen and to allow a person to talk through their experience and how they're feeling about being in hospital. The primary consideration for the volunteer is that you're there to be alongside the patients, not to offer advice, but simply to listen and help the patient talk through what's going on for them and how they can feel supported.